Hi friends, welcome to classes by Lab Doctor. In the previous videos, we have studied what is atherosclerosis, what are the risk factors for atherosclerosis, and how does this atherosclerosis develop over a period of time. So, in this class, let us concentrate upon the symptoms of atherosclerosis. So, when I tell about the symptoms of atherosclerosis, especially in the early stages, there may not be any symptom of atherosclerosis. So usually as and when there are physically or emotionally the body gets stressed, it requires more oxygen. That is when the symptoms of atherosclerosis comes, and that also depends upon how many arteries are affected and other risk factors. So let us see what are the possible symptoms which we expect to see in a person who is having atherosclerosis. So I've told you that usually we do not see any symptoms in the early stage, and we can see few of the symptoms depending upon the arteries involved, the other risk factors, the increased stress of the body, the symptoms can appear. So it could be chest pain, it could be fatigue, it could be shortness of breath, it could be weakness, it could be numbness of the weakness in the leg muscles, it could be confusion, difficulty speaking, there could be temporary vision loss, there can be claudication, there can be drooping muscles in the face. So any of these symptoms can appear if the person is having atherosclerosis, depending upon which artery is involved, how much was the oxygen requirement, what are the other risk factor he had. On all these things we get the symptoms. So let us first concentrate on the first symptom, that is angina or the chest pain. So the patient who has atherosclerosis, you all know that his blood vessels are narrowed. There is decreased blood flow to the muscles of the heart. So whenever there is any kind of a physical or a emotional stress, the blood flow to the muscles can all the more reduce whenever there is an atherosclerotic plaque, and the need of oxygen to those muscles may not be met, and the patient might have symptoms. He can feel, a very heavy thing lying on his chest. He can feel some kind of a tightness in his chest. He can feel weak, he can feel fatigued, he can feel nauseated, there could be sweating. So this is what is called as angina. So, and this I have told you because of the partial obstruction or the spasm of the arteries that supply blood to the heart muscles, and the fatty deposit or the plaques, they are the one which are the culprits here. So this is also called as angina pectoris, and this chest pain or pressure which occurs when the heart muscle is not getting enough of oxygen. It's a cry of the heart muscle. He can feel the pain sometimes in his upper back. He can feel it in his arms. He can feel it in his neck or in the earlobes towards the shoulder. There might be a shortness of the breath. The second symptoms which we talk about is dizziness. This can also be a symptom of atherosclerosis. Now, dizziness can occur because of various conditions, but atherosclerosis also can present as dizziness when the arteries, they become very narrow and they are blocked. Next symptoms could be fatigue. So you know what happens whenever there is this fatty plaque buildup in the arteries, and these are the ones which deliver blood to your kidneys, your brain, your heart, your limbs, etc. So when this blood supply is reduced, and as and how this disease worsens, patient can have very decreased oxygen supply to these organs. There can be extreme tiredness, there can be loss of appetite, nausea, feeling sick, etc. So all these things can happen whenever the patient is having atherosclerosis. So fatigue can be one of the symptoms of atherosclerosis. Fatigue can occur because of various function, because of because of decreased hemoglobin, because of kidney problem, liver problem, deficiencies, etc. But atherosclerosis can also present as fatigue. Can see that the patient is having tachycardia or increased sweating, because whenever there is decreased blood flow, they can present in this manner also. Patients sometimes can present with numbness. So why numbness? Because the arteries in your brain, whenever they are narrowed, they can present as weakness in your arms or in your legs. Patient can have trouble speaking, there can be slurred speech, there can be temporary loss of vision. So all these are the symptoms of TIA, transient ischemic attack. So for a short period of time, transient, the patient had ischemia and he had all these symptoms, and immediately he recovered if the blockage is not complete or if it is not causing that much of a damage. So these are the different types of stroke. Here you can see this is an ischemic stroke wherein it is completely blocked here. Transient, it is blocked but the blood flow is still going on. So the patient will recover here, and here this is the hemorrhagic stroke. So I've told you, whenever there is a transient ischemic attack, the patient will have, he might have a complete paralysis or numbness of a body for transient period or a small time. He might have blurred vision for some time. He might have vertigo, and he might have dizziness. So these are the symptoms of TIA. Here you can see the patient can lose his balance. Eye can be, there can be blurred vision. The patient face droops on one side. There can be weakness or numbness or the arm drooping, and the speech is blurred here. So these are the symptoms of TIA. Then the patient can have claudication. So what is claudication? Claudication is the pain which occurs when the patient is walking or climbing stairs or doing some physical activity. So whenever the patient will rest, the pain is relieved. So he will experience the pain in his legs, in his calves, in his buttocks, etc. So usually by resting, this pain will subside. So sometimes the patient can also have symptoms like weakness, tingling, numbness, etc. So these are all because of the involvement of the vessels in the limbs or the peripheral vascular diseases. So the blood vessels supplying the limbs, when they are narrowed, the increased demand which is coming when the patient is walking, running, exercising, that cannot be met with this compromised arteries, and then patient will have such symptoms. That is called as claudication pain. It is an indication of a peripheral vascular disease, and atherosclerosis can present with claudication. So here you can see this is the blood vessel supplying the leg, and here you can see a normal artery which is allowing complete blood flow. Here it is narrowed. So when it is narrowed and there is an increased need, it will not be able to cope up with the demand, and the patient can present with pain. So there are few warning signs of atherosclerosis. That is, if the patient is having chest discomfort during exercise or an emotional stress, he is having some kind of a tightness, or he is having some kind of a discomfort, heaviness, etc. That is a warning sign. Suppose if the patient is having pain while walking, etc., that would also be a warning sign. If he is having shortness of breath even after a light activity, that could also be a warning sign. Please remember, all these signs can come in various other conditions. Atherosclerosis is one of it. So remember, these atherosclerotic symptoms may not come in the early stages, but as the risk factors will increase, where there is an increased demand, where there is an stress to the body in the form of an excess of oxygen requirement, or an emotionally stressed person can have such symptoms of atherosclerosis, depending upon which artery is affected. Suppose if the arteries of the heart are affected, then he will have symptoms related to the heart. He might feel chest pain, angina. He might feel fatigue. he might feel tachycardia, he might get cold sweat, he might feel shortness of the breath, he might feel weakness, he might feel nauseated. And this all can happen if the arteries of the chest are involved. Sometimes if the arteries of the legs are involved, patient can have claudication pain. He can have pain while walking, or when he's exercising, he's climbing stairs. So that time he can have pain in the legs, or sometimes pain in his arms. There will be cramping in his buttock while walking. So all this can happen when the peripheral vessels or the vessels supplying the limbs get involved, the upper and the lower limb. And sometimes whenever there is the vessels of the brain are involved, patient can have symptoms of TIA. Patient is having TIA, he will have few of the symptoms, like he can have slurred speech, he can have confusion for a transient time, he can have numbness or weakness in one half of his body. So patient can recover quickly. Transiently this ischemia will remain, and the patient will have all these symptoms. They can be confused for some time, and after that he's okay. He's having vertigo for some time, then he's okay. He's just having numbness and weakness for some time, and then immediately he becomes okay. Then whenever there is a transient attack. But suppose if there is a complete blockage, then the patient can even present with paralysis or stroke. So all these are the symptoms of atherosclerosis, mainly occurring because of the formation of the fibrofatty plaque, and that is one which is compromising the blood supply to the organs. May it be your lungs, may it be your heart, may it be your kidneys, may it be your upper and lower limbs. So depending upon the organs involved, depending upon how many arteries are involved, depending upon the various other risk factors, these symptoms can appear. Thank you so much for watching the video. Please like, share and subscribe the channel. Thank you.